So what do I tell patients when they ask me if PPIs are safe? As a GI doctor, I prescribe a lot of PPIs. That's proton pump inhibitors. Prilosec, Nexium, Protonix, omeprazole, pantoprazole, they're all PPIs. They can treat a lot of GI conditions. GERD, ulcers, Barrett's esophagus, EOE, H. pylori. I probably prescribe them every day, and nearly every day a patient asks me if they're safe medicines to take. What are the side effects? So initially when PPIs came out in the late 80s, they were a godsend. They revolutionized how we could treat heartburn and ulcers. But we started using them for everything. Any mild nausea or abdominal pain got you a PPI prescription. Now, over the subsequent 30 to 35 years, there have been some studies showing a correlation of long-term PPI use and multiple negative side effects: osteoporosis, B12 deficiency, kidney disease, C. diff infections, and even dementia. Now, these weren't randomized trials, meaning they didn't take two groups and give one group PPIs and another group a placebo and then monitor them over time. They took groups of people who had already been taking PPIs and compared them to groups of people who had not been taking PPIs. And they found that the PPI group had more of those diseases that I just listed. So we don't know that PPIs caused them because the studies couldn't control for all the variables. But even if they do cause these effects, and they might, they mostly occurred with long-term use, typically multiple years of use. And also, most of these effects are things that we can monitor for before they become significant with blood tests or DEXA scans, for example. The most important thing is if we know you have a condition that we know benefits from PPIs, then that benefit far outweighs the theoretical risk of these rare long-term effects that we can monitor for you in most cases. If you're just on a PPI for unclear reasons, then that benefit is likely minimal, so there's really no reason to test those theoretical risks by staying on a PPI for years.